You might assess the needs, but you weren't able to assess what he knew. And I'm concerned that we still don't see in the educational system alternative ways to measure what people know. And I find that after sort of saying to everybody, my son will graduate if I have to drag him and everyone else kicking and screaming to the podium, and he did graduate in the middle of a class of 120 with an 87 average, part regents, part regular classes, and went on and graduated from college with a 4-year degree, because along the way he met instructors who were willing to assess his knowledge in a different manner than a written paper or a rote memorization to put down on a test. So where are we in that? Because I think if you can start taking people who learn differently and learn how to assess them, your costs are going down. Any movement on that?
Yeah, I'm going to defer to our curricular expert on that, but I guess what I would tell you is, again, we think about sharing and regionalizing and bringing kids together, you know, for differentiated learning experiences like we do at the tech centers. That's going to be more effective. I know Steve could tell you more in terms of where are we, because I didn't ask you when your son graduated, and I don't.
97.
Okay, so yeah, and I think the world has drastically changed since then, and actually in the next few years, and again, Steve is our point person on that, it's going to change even more dramatically, and I'm okay with that. As Steve pointed out, it's creating a lot of anxiety, but education has been an industry, for lack of a better term, that has been very resistant and very slow to change. So I'm excited about it, and Steve, I don't know if you want to talk about the timeline that some of those changes might.
Sure, and I mean, what you're describing, of course, is performance-based assessments, which I think we would all acknowledge is a better way to measure in most curricula than your standardized multiple choice type test, correct? I mean, instead of saying there's one way to be successful and you are all going to be a square peg fitting, thank you. We're all going to be a square peg fitting through the same square hole, which we all know is not the case. Performance-based assessment is really the answer. One area in which we hold out a great deal of hope, as I mentioned, is if we can recognize as a state and acknowledge that there need to be multiple ways to be successful moving from point A to point B, in all of those curricula that would constitute alternate pathways, it would be performance-based assessment that we'd be using to measure students' success. I'd like to be able to tell you that we're moving swiftly towards performance-based assessment implementation in all of our academic subjects. I think because of the speed with which so many new assessments are having to be put in place, I think we're actually seeing in the short term more standardized types of assessments that move away from that. But I think in the longer term, if there are enough of us, and I believe there are, who focus upon that we have to find ways to make more performance-based assessments the ones that we use in our data-driven instruction, those interim assessments, and hopefully as the new summative assessments that are being created by the Partnership for Assessment of Readiness for College and Careers, PARC, which is the 24-25 state consortium that New York State is a part of, to develop the next generation of assessments, which will begin implementation in 14-15 and beyond. We've got to see more performance-based measurement rather than this is the multiple choice question that's going to tell us whether you got it or didn't get it. I'd like to tell you that we were moving swiftly in all curricula in that direction. I think we're going to have to all continue to push on that. But that's, in my opinion, the way to go, and I think certainly multiple pathways would help us. Did that answer your question, I hope?
Yeah, I'm just trying to get a sense of where we are today with that. Yeah. Obviously, you know, my son was fortunate. He went to Canton School. He had people willing to assess him in different manners. When he got to college, he had college professors who saw that he knew the material but he didn't test well, so they gave him alternative methods. And I just think sometimes our educational system is so cumbersome, it's like trying to stop a boulder coming down the mountain or an avalanche once it started. You know, to divert it into areas that can prove productive instead of destructive.
Good. Thank you, Judy. I think we're on our way. We'll put it that way. So if you would, we're not going to take a break now before our keynote speaker. But have a look at the back of your program. I am not going to spend a huge amount of time introducing or talking about and rehearsing John Sipple's wonderful background, but I will tell you this. We have met Dr. Sipple, and we have found him to be an extraordinarily engaging and interesting person. He has spent a lifetime studying the kinds of issues that we're addressing in this symposium. Perhaps, in fact, he'll even tell you about some of the work that he's done just most recently in Ireland, which is almost like a compressed example of what happens when there's economic difficulty to an entire nation. So it's interesting. John Sipple.
If you're wondering who I am and why I don't look like this guy, it's a 14-year-old picture. If only we can go backwards. All right. Thank you very much. And this is a wonderful, wonderful opportunity for me to be here and to learn about, to learn about the work of the North Country Symposium. I want to thank the Burke family, all the planning committee, the wonderful people we met with a few weeks ago when I was up here to prepare for this, of course, St. Lawrence University. But all of you for coming, and it's really a remarkable testament to the North Country that we can bring, once a year you bring together people from a whole variety of what on academic campuses we call disciplines, but different walks of life, different professional careers, different, whether you're tied in with the healthcare community or the private sector business community or retail or agriculture, whatever it may be, because this is how the real world works. This is how real communities work. And so too often these kind of conferences are very, very siloed, to steal a term, in a particular sector. And they're not as productive as they could be. So I'm hoping desperately that I can take advantage of that today, and you'll find this next 45 minutes to an hour useful, insightful, thought-provoking. And if not, just throw me out and I'll get out of here. But we'll do the best we can do. All right? I wear two hats. Well, I wear about 6 hats, but 2 hats that are on the screen here help explain where these remarks come from. One, I direct the New York State Center for Rural Schools, and as my job as a professor at Cornell, I was tasked with running this program that began in 2008, relatively recent. And this is back during the boom time, back when the university had money and the state had money and so forth. And we created this center to shine a bright light on the rural areas. There's a multi-million-dollar research institute down at NYU that handles New York City. There's other multi-million-dollar research institutes that focus on big four issues and so forth, larger cities, inappropriately so. But there was nobody, no systematic entity in New York State that really focused in a research or capacity-building way on the rural communities, and that's what this is. The other hat I wanted to share is my co-director of the Cornell's Community and Regional Development Institute. And so there's this community and regional development hat I wear, and there's a school hat I wear, and that fits into what was going on today. When I first got the email, either inviting me to be the speaker for this or finding somebody else to be the speaker for this, and they described what the North Country Symposium is all about, I didn't send it to anybody. I didn't forward that to anybody. I said, I want this. I want to do this. This is really cool. And so here we go. Oops. There we go. Here's what I want to do today, okay? I want to stimulate a conversation and discussion that will start today, hopefully in the next few minutes, but continue on for days, months, and years, okay? And this is about opportunity in an era of challenge. I really, really cannot stress enough how David Acker's comments resonated with me as he was going through the reality of the healthcare industry, the reality of the educational industry, and how they need to come together. I just had the good fortune to be down in Washington, where it was 85 degrees, last Thursday and Friday at a conference run by the Federal Reserve Bank. And I presented a paper there, which some of this today comes out of that paper, a couple slides. To wrap up the conference, Ben Bernanke came and spoke to us. This was not a personal conversation with me. There's 300 people in the room when the chairman of the Federal Reserve walked in and gave a talk. He gave part of what was just said by the president of your local hospital. That was his message, the linking between the healthcare issues and the educational issues. That's what he said. Now, in fairness, he did not say it anywhere nearly as eloquently or as powerfully as we just heard here from David Acker. But it's these linkages are really, really key. I also want to link one more group in there, which is so central. And this goes back to when the governor and the legislature were pushing for the property tax cap. Remember this conversation a few years ago? And as this was coming down the pike, and as it became apparent that this might happen, that it might be a property tax cap, and you saw two very big lobbies line up and start shooting at each other. One big lobby was the private business sector in New York State, okay? They came out fully in favor of this. And on the other side, you had school people and the other municipal people, but the school people are well organized and come out against, and they started throwing arrow, choose your metaphor, shooting arrows, whatever, at each other. And that can't happen. Just like, as David Acker said, the hospitals and the schools can't be bickering over the same pot of money. The businesses and the schools and the healthcare system can't be fighting each other. They need to come together on this. And so that's, again, the point of this symposium. Okay, whoops. Uh-oh, look at that. Oh my goodness, how do I go backwards? Sorry. Okay, man, oh man. Oh, I can just wheel up? Wow. Okay, I can wheel up. All right. I want to share some insight from some recent research. I'm not going to belabor these. If anybody wants to talk more with me in a different time and setting around some of the research that we've been doing, I'll be more than happy to talk about it. That's kind of what we do. But I don't want to put too much of that on you today, but I'll go through that a little bit. I want to offer a view of schools linked to communities and the different ways in which that linkage happens, in ways that we often don't think about. Often I share with people the work I do about linking the impact of schools on communities. And they look at me with this blank face, what does that mean? You go to school to learn math, you go to school to learn science, how can that impact the community? I think many of you understand this linkage, but many other folks don't. And I want to provide a little vision of that. I want to wrap up, and this will be more this afternoon, so I'm not going to try and do all this in the next 45 minutes, but offer some tools and ideas for the immediate and long-term improvement of local decision-making. One of the goals of our center is to take information, take data, and put it in the hands of local decision-makers in a much easier, much more user-friendly way, so that local decision-making can be enhanced and informed, and we can take the guesswork out of some of this stuff. Okay. I realize we have central questions, and I got no question marks after the first two lines there, but pretend there's question marks, okay? What is the impact of schools on communities, and what is the impact of the communities on the schools, and how much these things really are synergistic in both good and bad ways, or good and challenging ways? How did schools and communities become separated? How did the schools become so professionalized, in a sense, to become a bit, in some places, a bit more removed from the life of the community? What are some key policies and programs that get at this, that are ways to think about integrating schools and communities that you might not otherwise have thought about? And then lastly, what should we do? Okay, you bring a professor up here and you can't help but do a little bit of this. And so bear with me, but I think it's telling, or at least symbolic, okay? There's a wonderful book written in the 1950s about this 1908 to 1912 period, roughly 1910, that really describes for the first time the professionalization, for lack of a better phrase, or the administration, the growth of administration that governed schools. If you go in New York State back then, prior to this 1910, we had somewhere over 10,000 individual school districts. Okay, now most of those are one-room schoolhouses, one little buildings. And beginning around this time with what we call the administrative progressives, they took their key from the most successful business people of the day. Okay, and the most successful business people of the day were running big factories. Okay, and designed their businesses to have a leader, real bureaucratic structure, and then that leader was looking over somebody else's shoulder, looking over somebody else's shoulder, and so forth. And society really granted these folks an awful lot of power, an awful lot of authority, and granted them an awful lot of honor, in a sense. All right? What we did, well, most of us weren't around, but what happened then was the schools began to take on this same governance structure. And so the role of the superintendent was created back around this time. School superintendents didn't exist before then. Okay? And the role of the superintendent was to count the number of widgets that were going through the school. Count the number of widgets going through. Now, the widgets are, of course, kids. Okay? But the first thing that was measured is how many kids are going through school, and the superintendents are supposed to count those, and how fast. And their productivity, they were hired and fired on their ability to get more kids through the schools for the least number of dollars. It was measured by simple completion. Okay? Now, I'm oversimplifying a little bit, but if you read this book, it's fascinating. And you could, as you're reading it, you're thinking, is this 1910 or 2010? Just a thought. Okay. Now, let me not leave it right there. Superintendents today and superintendents back then do a whole lot more than counting how many kids go through their school, okay? A whole lot more. It's a stunningly complex job that I'm forever thankful I don't have that job, okay? But amongst other things, we like to count. We like to measure, and that's what counts in this society, okay? So the pressure to count is coming from this, and it's been around a long time. Okay. 1953, we had a new federal department. Department of Health, Education, and Welfare. Now think about what most of us remember that, health, education, and welfare, okay? Think what goes on in health, in education, and in welfare. And in a siloed kind of society where we like to have these governmental silos and governmental agencies, that was all one federal agency. Then, for a variety of reasons, there's a wonderful dissertation on this that I didn't write, and I won't make you read. But if you have any quirky interest in this history, it's fascinating. It was the creation of the U.S. Department of Education in 1979 under President Carter. And this really pulled out education from health, education, and welfare to make it more professionalized, to make it more focused on math and science and reading, and not be bogged down with some of these other health and welfare issues. Because schools were supposed to be something special about learning and linked to jobs and so forth. I'm not going to belabor the point, but there's this little bit of history that created this separation at the federal level, which I think is very symbolic, okay, of how we think about health, education as being separate and distinct. And as we just heard earlier, and as you'll get an earful from me today, okay, we need to go back to those old days where this is much more integrated, okay? I'm sure it was different up here, but when the regional economic councils were developed a few years ago, the southern tier one where I live, got together. The only the only person who had anything to do with a school that was anywhere part of this regional economic council was the president of Cornell University. And no offense to my president, but that's a stretch. Okay. He's actually a physician by training. And so there's actually more of a link to the healthcare sector than. Okay, I'll get myself in trouble all over the place today. This is an overly simplistic view of what I call the real world. And this is my comments a few minutes ago. In the real world, you have bankers interacting with lawyers interacting with medical professionals, interacting with educators and so forth. And this is how the world works with all this. And there's opportunity and nutrition, health and assets and all this kind of stuff. And any one of us could draw this and it would look 100 different ways, and that's fine. But this is how our bureaucracy works. This is how we function administratively. These are how dollars flow, and these are how regulations are set up. Okay? We often talk to folks, why don't you partner? Why don't you share? Well, the dollars I receive from X agency aren't allowed to be commingled with the dollars we receive from the Y agency. You can't do that. The accountability structure is different. The boundaries are different. School district boundaries, for instance, have nothing to do with county boundaries, by and large. And I believe there's one school district in here that's part of 3 or 4 counties. Yeah, there. But there's these crazy little things that get in the way of some of this collaboration, okay? All right. That's the bureaucratic part of the conversation that we can come back to and talk about, and how to spend some time this afternoon, how do we bring those together? Excuse me. This is a different way to think about these synergies, okay? And this is from the journal Pediatrics, and there's an article recently that talked about the new science of pediatrics. Now, I'm not a pediatrician. This is not on my weekly read or my monthly read, reading pediatrics journals. But I found this really, really interesting and telling and appropriate for today. Any other physicians or nurses or the healthcare sector? Okay. Well, then I've become the expert on this then. That's a dangerous thing. All right. What we see is the basic science of pediatrics. On the right, lower right, we got health and development. This is how we typically think of the role of a pediatrician. Okay, and this has traditionally been when you bring your kid to the pediatrician. I have 3 kids, and we go into the pediatrician, done this for years. Okay, they worry about this lower right-hand corner. And they worry about the top. Maybe more so the top than the right-hand corner, depending on the pediatrician. Okay, but the lower left is often not part of the conversation. And certainly all 3 of these together is often not part of the conversation. And so this is being presented as a new way to think about pediatrics. Okay, we need to think about the ecology in which these children, not just patients, but in which these children are functioning. And it's the social and the physical environment. And over here, the learning and behavior and the physical and mental well-being of children. Okay, and then of course the biological stuff up top. I apologize on this one, okay? Because you can't read that, can you? No. I can't read it and I'm up here. This is the quality that came out of the journal. I couldn't do anything with this. But if you look at the slides later on, I think we can get them posted. You can read it when it's shrunk down a little bit. The left-hand side, here we go. Okay, has a number of policy and program levers for innovation. Okay, if you want to jot some of these down, we can come back to these later on this afternoon or maybe later on this hour. Okay, and it has everything from primary health care to public health, child care, early education, okay, child welfare, abuse and so forth, early intervention. I think that says family economic security, stability. It's fuzzy, okay? Community development and private sector actions, okay? This is the new vision of pediatrics. These are the policy levers we need to pay attention to. These are some of the caregiver and community capacities here. Okay, the foundations for healthy development. The actual biology comes into effect here. So all these issues here, from policies to capacities to different foundations of development, impact and are embedded in the biological development of children. Teachers here? Any teachers here? Okay. And I used to be a middle school teacher before I got brainwashed into this whole university thing. You know and I know, and please tell me if you disagree with this, that a kid who comes in the morning and who has had breakfast, who wasn't beaten up, who is healthy, doesn't have an ear infection, doesn't have a toothache, much easier to teach than a kid that has those problems. And this is not rocket science. Every teacher will tell you that. Okay, much easier. And yet we heap all this pressure on these schools to do the math and the science and all these kinds of things, which they should. It's a school. Of course they do that, okay? And yet we then walk away from the conversation about who gets prenatal vitamins and who doesn't. Who gets access to health care when they're little, okay? How easy is the access to health care? And we know in rural areas, access to health care is an enormously important issue, okay? Dental care, mental health. All these issues are much harder in rural areas to access than in the less urban areas. We know that, all right? Okay, so this is this new perspective that is kind of a different metaphor for what I want to talk about today and what we collectively as a group want to talk about today. Kinds of buttons here. Okay, some of the conversation that came up earlier is linked to this. And this is where we come in, where we really get into trouble, or I shouldn't say get into trouble, have really challenging conversations about what to do. On the one hand, we have parents who have kids who are high school juniors right now. We have parents who have kids who have kindergartners right now. This is their one shot to go through school. Their one shot to go through kindergarten. The one shot to go through the junior year, which we all know is arguably the most critical year in preparing yourself for college as far as transcripts and GPAs and tests and SATs and all that stuff, okay? And then we get these other issues that we need to attend to, like the general health and well-being, the future relevance of what they're learning, okay? So you have this unlinking of these long-term community-based issues and these short-term immediate educational issues, okay? And if you're teaching in a school building and you have a set of 27 kids in your classroom and you're trying to address their needs, and the state says, well, here's an exam that we're just trying to work the kinks out of, okay? And we'll get the kinks worked out because this will be a better exam. Now, don't get me wrong. I think this will be a better exam. I think this will be a much better system when all the kinks get ironed out. But the reason this is so contentious, and you read this morning's paper, big article about this, and parents holding their kids out. The reason it's so contentious is the kinks aren't worked out, and this is the kids' one chance to go through whatever grade they're in. So what do we do about that? Because if we only pay attention to the immediate needs of the kids today, in whatever grade they are, we're never going to get to the long-term issues. We're never going to fix the system, change the system. Not going to happen. But how do we change the system, fix the system, integrate the system, create better exams, create more project-based, or whatever it may be, performance-based measurements, unless we have some necessary inconvenience to the folks going through the system right now? So this is, and unless you have an idea, I have no answer to that. There is no answer to that. But that's why it's so politically contentious and so hard to do. And I think this is why John King says, we're moving forward. I hear you. I hear all the griping. I hear it every single day, 24/7. We're moving forward. And we can agree or disagree with him on that. Okay? But I think that's where that political tension comes from. Both arguments are legit. We need to change the system. We need to find efficiencies. We have no choice but to find efficiencies. But we also need to take care of the kids who are in the building, in the classroom today. And so this conundrum here are short-term school-based, long-term community-based issues. Really, really important. Okay. Throughout the next 20 minutes, half hour, we'll talk about some of these, and then this afternoon we'll talk about some of these. There's a million levers to pull, a million things to do to improve our communities, okay, to assess our communities, to improve our mathematics instruction, improve our reading ability for pre-K students and so forth. Yeah, you pick, there's a million different topics, a million things to do. These are some that I know something about, some I have some interesting slides about, okay? And each one of these, though, and you might not, when you initially look at the list, you might not recognize it, but every single one of these shapes both schools and the communities that the schools are serving. They may look like school levers. Every one of those impacts the community quite directly. And let me take you through some of those. well, this is out of place, sorry. But important, okay, my mistake. This is, you obviously know what this is, a map of your region. And so a quick little background demographic check, okay? This comes out of